Welcome to your treatment area, first year Crowder students. This is Dr. Eaves, as you well know by now, and I am here to give you a brief, hopefully brief, but really, I talk a lot, brief introduction to the physical exam. We have a willing participant here in Miss Whiskey, hand to Whiskey, hi Whiskey, who is walking herself around the treatment area. But what you need to have first in order to do a proper physical exam is you have to have A, good working hands, B, tools. So, leash, super important, sometimes even for cats. Ears, this piece of equipment, as I know you all know, is called a stethoscope. And I've got some other pieces of equipment over here. Please follow me. So, we have a thermometer. We'll talk about that in just a few minutes. And we also have this tool right here, which has a detachable head on which we can place another item. We'll also talk about this in just a few minutes. But as we start, first things first, you want to get a full systems overview of your patient. Now, Whiskey here, if we'll pan down to Whiskey and we'll kind of pay attention to her, I can learn a lot of things about Whiskey from just watching her move around here. We'll pretend like this is an exam room. So first of all, what is her mentation? And a lot of you guys identified that word in your vocabulary terms as one that you didn't immediately recognize. Mentation is basically their spatial awareness, their mental state. How do they look? Now this girl here, she is pretty darn bright, alert, and responsive, otherwise known as BAR. BAR, yes, you BAR, you are. The other thing that I can see very clearly about her as she's like moving around here is I can get an assessment of her ambulation or her walking. So she is walking around this area. Come this way, Whiskey. She is walking very normally, very comfortably. There's no limping, there's no lameness, there's no ataxia, which is wobbly walking on a whole. And I can also get a pretty decent assessment of her behavior here. This is a friendly little dog for sure. This behavior will be very, very different from the Cocker Spaniel that we currently have as well. But I can also get a body condition score on her. And we body condition score generally on a scale of 1 to 9 here, with 5 being ideal. 9 is a walking ottoman, a 1 is a walking skeleton. This girl here, let's face it, she's a chunk. So she's probably a good 7 on a body condition score for me here. So I can see that she is bright alert. I can see that she is moving around without any difficulty or any lameness. So what I'm gonna do next is I'm gonna pop her up here on the exam table. Come with me. Would you like to come with me? Before I do that, I'm gonna put a leash on her neck, although this is a very friendly dog and won't bite me, but that gives me another point of control over her. Hi, I know. So I'm gonna pick her up using proper ergonomic principles, meaning I lift with my knees and not with my back. So hand up under here, hand up under here, hand up under the axillary area, and I lift with my 50-year-old knees instead. And then I'm going to bring Ms. Whiskey over here to the examination table. So one of the important things about physical exam is that you always do it in the same order, in a specific order. That order can truly be anything that you want it to be. But for me, I usually start tip of the nose and work my way back to the tail base. So looking at her, one of the things that we want to assess is this dog symmetrical? And by symmetrical, we mean, is she the same on either half if we divided her with a median plane? So we start by looking at her nose here. So looking at her nose or her nares, are they open? Patent is the vocabulary term there. Is there any nasal discharge? Is there any excessive noise coming from the nose? There is not. This is a pretty normal looking nose here. And then as I move back, I'm taking a peek at her eyes. So are her eyes symmetrical? Are they moving together? Do they both look nice and clear on the surface of the eyes or the cornea? What do the whites of her eyes look like? Are they normally normal and white? Are they red and inflamed? Is there any eye discharge here? Any mucus discharge? Any redness associated with it? Is one eye bulging more than the other? What would be called exophthalmos? And they're not. She's a really, really normal little dog. Then I would go and I want to evaluate her oral cavity and her teeth. Number one, I want to see, does she have a normal bite? meaning does she have normal occlusion? And she's got very normal occlusion. So top jaw, bottom jaw lines up nice and neatly here. She does, however, have a lot of dental tartar and calculus. So she's got periodontal disease, good bit of dental calculus, tongue's moving in and out. I don't see any swellings, growths, ulcerations, or lesions there. I'm gonna pop her mouth open and say hi. I know, you're terrible. Yeah, that's rude. That's so rude. That's so rude. She's swallowing normally through that whole thing. Again, I don't see any growths. I don't see any foreign bodies in that area either. Once I've had a chance to look at her eyes, nose, mouth, head, shape, and conformation, I typically will move to the ears, and I often have an assistant, but I'm working solo today, which is a real dangerous thing as a DVM. So I'm gonna look at her ears, or her pinna, her ear flaps. I'm gonna lift those ear flaps up. I'm gonna evaluate them for redness, odor from the visible ear canal on both sides, symmetrical. Yep, they're pretty clean. Right now, they're pretty clean. Yes, they are. They're pretty clean. All right, and from her ears, I'm gonna move down to the regional lymph nodes. So the lymph nodes, we're going to talk about those in A&P, but they are little collectors or little waypoints essentially in a patient's lymphatic system. And the three places you'll really be able to feel lymph nodes on your animals, number one is the submandibular space, right here at the base of the jaw where the body and the ramus of the jaw interact. So submandibular lymph nodes. Number two is what we call prescapular lymph nodes. So right here in front of her shoulders, there's a set of lymph nodes there, and they may be slightly palpable if they're normal. You may not feel them if they're normal. You definitely feel them if they're abnormal. And I'm gonna feel either side, and those are pretty unremarkable. And then on the surface, from a physical exam standpoint, the other place where you will find peripheral lymph nodes is the back legs. So we're gonna spin you around, Whiskey, so we can put your butt here. I'm gonna lift you up on a one-handed physical exam. The popliteal area is right here behind the knee. And so there's a lymph node right here and a lymph node right here on the other side. And actually, little Miss Whiskey here, she does have a mildly enlarged left popliteal lymph node compared to the right. And oh my gosh, you are stinky. She is farting as well because she is anxious and has no idea what I'm doing. So, popliteal lymph nodes. We've got one slightly large lymph node. Hi, you're a doll, back here. From there, I'm gonna work my way back with my hands along her neck area, and I'm gonna palpate or feel of her neck area, move her neck back and forth, see if I get any evidence of neck pain. And some animals are gonna be easier than others to do this in. Hi, I know. And I'm gonna work to her musculoskeletal area and work down her front legs. So I'm gonna extend and flex each joint, shoulder, elbow, carpus, toes, looking for any pain, feeling and palpating for any abnormalities. Now our cat's back here, one of Mr. Pruitt's cats has a healed fracture of his right rear leg, his tibia, and I would definitely encourage all of you to palpate that, put your hands on it, and feel the irregularity in that leg before he goes back home to his people. I know you, sweet girl. So moving on to the other leg, I'm feeling for any crunchiness, what we call crepitus, which could indicate osteoarthritis. I'm feeling for any asymmetry, which could indicate a previously healed wound or an active wound. I don't feel anything. I'm then gonna move to the back legs of this girl. So back legs, we got the hip, we got the stifle, we got the hock or the tarsus, and we got the digits. So starting down low, ooh, she's stinky. Yeah, let's flex your hock. I'm gonna palpate her knee and her patella area right here, making sure it feels stable. I'm gonna flex her hip back. Again, I'm assessing range of motion, and if anything is uncomfortable or has limited range of motion or any crepitus or crunchiness, I'm gonna come over here to the other leg. I'm gonna do the same thing. You've already watched you walk, so we know you're not lame. So basically this would be like an arthritis check, essentially. Extend and flex that, checking her kneecap really nicely. Yes, I know. From there, when we're solely with my hands, I'm gonna move on to palpating and feeling her belly. Now, almost all these guys, these ladies that we have here with us are a little on the chunky side. So abdominal palpation or feeling the organs in her abdomen is a little bit more challenging with some of these. And I'm just gonna take my fingertips on either hand, and normally I'd have somebody holding her head, and gently kind of compress and feel downward. And what I'm feeling for is any pain, any splinting, any enlargements in here, which could be what we call a mass effect, or cancers or tumors can do that as well. And as I work my way back, if you have big liver, you can feel it. If you have a horribly distended stomach with food, sometimes you can feel that. Cats, you can feel a whole lot more because there's a lot less abdominal musculature, and they're smaller, so you can do them one-handed. Sometimes we can feel if there is a bladder, or if she's got a full bladder. And on this girl here, let me palpate and just run my fingers real gently back and forth as I'm squeezing. She does have to pee. She's got a little bit of urine in her bladder, but it's not overly distended. Nothing I'm doing is eliciting any pain from her. And abdominal palpation is pretty unremarkable. When I've gotten there, then I want to really take a good look at her skin and her hair coat. So I'm going to pull this hair back. Sometimes it can be helpful to use a flea comb, especially you're going to see a lot of itchy dogs in practice. I'm looking for any scabs, sores, lesions, all throughout her skin and hair coat. Now her hair coat is a little bit dry, but it's not overly flaky. I don't see any active wounds on you. No, I don't. Best place sometimes to look for skin lesions is over here on the belly. If you want to step right around here, and we'll take a look at the skin on her belly. Hi, I know. So this is the least haired area of the belly here. I know. And this little girl just had puppies a couple months ago, and she's been a breeder dog, so she has a little bit of pigmentation. She's got no active mammary development as I feel through her mammary chains. I'm not feeling any mammary masses. I don't see any type of skin lesion going on here. And then we'll move on to using some of our other tools that we showed earlier. Now, we'll start with the stethoscope. Shelly just came in to laugh at me while I'm taking this video. Yes, or I may ask her to be my trusty technical assistant. I put these parts in my ears, and then you'll see the terms bell and diaphragm on the stethoscope, and those are just for different frequencies. And a lot of our stethoscopes nowadays come with just a diaphragm type head on them, and you can get more of a bell effect with very light pressure on there, or more of a diaphragm effect with firmer pressure. When you're listening or sculpting, you want to listen and to the heart and the lungs, as well as to the gut. You can hear gut sounds on physical exam with the stethoscope. We'll start with the softest things first. So we'll start with the lungs, and I usually start towards the back of the lungs and work my way up to the trachea. So I'll start at the right caudal lung field as I listen on this side, and she's panting, so it's not a great evaluation, but I am able to see she's nice and pink. She's breathing comfortably, though she's panting, but she's not panting because she's hot, she's panting because she's excited. And I would describe her as panting, but eupnic, normal breathing pattern. And then I'm going to move just to different quadrants of her lung fields as we do this, and then I'll do it on both sides. Once I've listened to her lungs, I will come up here and I will listen to her tracheal area. Now, breath sounds are going to sound a lot harsher and louder in the tracheal area than they will down in the lung fields. Things that we're listening for are crackles, wheezes, what are called rails or rubbing friction sounds there that sometimes you'll hear, sometimes you don't. Her lungs actually do sound very nice and healthy. Yes, you do. You do, you do. And then I'm going to listen for her heart. And there's specific areas that you want to listen for the heart. We're going to learn those in companion and lecture when we start talking about heart disease of the dog and cat. And I'm going to listen for heart rhythm, and I'm going to listen for something called a heart murmur. And so heart murmur is just an indication of turbulent blood flow. And that can be from a number of different things, and we're going to talk about all of those. The one thing I want to stress as far as physical exam when it comes to auscultation, or the art of listening with the stethoscope, is one of the most important things that you can do, and I don't see doctors doing it enough, much less technicians, is you want to make sure you are listening and palpating the femoral pulse. Oh, stand up, sister. Okay, femoral pulse. So the femur, the femoral artery runs right back here, and it's one of our major pulse points in these guys. And if we listen and we palpate at the same time, what we're evaluating for is the presence of what are called pulse deficits, which means if there is a heartbeat without a pulse, that is usually a pretty good indicator that there may be something significantly wrong with that cardiovascular system. So super important that you always palpate that femoral pulse and listen to the heart and make sure there's a matching pulse for every heartbeat there. Now, I'm gonna put this girl down for 1 second, and I'm gonna get my other two tools, and I will show you how we utilize those. I didn't even know we had this thing. And this is an old otoscope. So otoscope, oto meaning ear, scope meaning to look at. And so the otoscope is utilized to look at a dog or cat's ears. Now dog and cat ears, our ear canals go straight in, but dog and cat ears, they're in the shape of an L, like this. So they go down, what's called the vertical canal, and then they go sideways with a horizontal canal. When we're looking at an ear visually without the aid of an otoscope, all we can really see is that vertical canal of the ears. Come here, sis. So she is probably not going to be super cooperative for this, but I'm not worried about her biting me because she's a really sweet dog. So with the otoscope though, I can also visualize the horizontal canal, and hopefully I can visualize her tympanic membrane. This is 8,000 times easier with a lot more hands. And in this kiddo, I'm not going to be able to safely, without poking way down in her ears, get a good look at her eardrums. But it is important you know that this tool is called an otoscope. And likewise, for further evaluation of the eyes, we have often the same tool, so same kind of stem, but a slightly different head. This is called an ophthalmoscope. And with the ophthalmoscope, we're able to look at the surface of the eye, or the cornea, inside the anterior chamber of the eye, into the posterior chamber of the eye, through the iris, and get a look at the retina, which is in the back of the eye. Again, we're going to learn all about the eye and A&P. But this has a light on it. The light on these batteries haven't been plugged in all summer, so this otoscope or ophthalmoscope is dead. But I would take this and I would evaluate in this way and shine that light through the iris, looking at her cornea, looking at the anterior chamber, and then hopefully, if everything's cooperative, looking at the retina, and I can see your optic nerve there. Yes, I could. Yes, I could. So this is called an ophthalmoscope. So ophthalmoscope for the eyes, otoscope for the ears, often have the same handpiece, often are dead of batteries as well. Then, one last part of the physical exam, and it's a biggie for me. No physical exam is complete without evaluation of the rectal area, the rectal exam, for which you will always want gloves. You will pretty much see me put gloves on in an actual work environment, a lot of times up here too, before I handle any patient, because the most important step, first step of nursing care for any of our veterinary patients is to wash your damn hands. But the rectal exam, obviously I'm not going to stick my unlubricated finger in her anal area, so lube is good for this. I cannot believe I'm videoing this at the moment. But so I would need a restrainer or holder in most situations. I would prop her up. Here is typically how I'll do it. Lift her little butthole. You want to come around to the booty hole side since she's kind of showing interest here. So look at that anus. It is pretty unremarkable. Maybe there's a little dingling here. And we can palpate from the outside where the location of her anal glands might be, and those are usually the 5 o'clock and 7 o'clock positions, and her anal glands feel relatively empty. While I'm here, especially because she's an intact female, I also can look at the vulvar area, and she's got a little bit of a hairy vulvar area back here, but I don't see any swelling that would indicate she's in heat. I don't see any discharge that would concern me for things like a pyometra. Rectal exam, I would go in. You're not gonna let me do this, are you? She's like, I don't know, I might. So, I might, what a good girl. What a good girl. So, on a rectal exam, we can actually feel quite a few things. So I can get a better sense of the anal gland. I can feel that one slightly full on this side, fairly empty over on this side. On male dogs, you're able to palpate the prostate in this area. And in trauma patients, especially like hit by car patients, a lot of times you can actually feel the floor of the pelvis broken, so you can feel pelvic fractures with a rectal exam. And then the other thing that a good quality rectal exam allows you to do is get a stool sample if needed. And she's willing to give us a pretty decent one. And what is in here? She has grossness in her poo, something that she shouldn't have eaten. And it's either plastic or hair or fiber. And I am known for picking through poo, and I'm now doing it on video. But, so then I have a ready sample for a fecal analysis if that needs to be done. But start to finish, that is roughly it. You know, the neurologic system is one that is very difficult to assess on a true like skill standpoint. Neurologic assessment is mostly visual and seeing how she's behaving, how she's walking, is she acting normally. Likewise with GI, musculoskeletal. But I think I've talked long enough about this, and I have poop in my hand. So I'm gonna see you later, guys. Bye-bye.